This video is about basic wound care for your uncomplicated surgical wound. This includes information about cleaning a wound, changing a bandage, and preventing infection. A surgical wound is a cut in the skin that was made during surgery, also called an incision. Follow your doctor's instructions about when to take the dressing off, when it is safe to get the incision wet in the shower, how long it needs to be covered with a dressing. Most incisions do not need to stay covered after the first few days, but they do need to stay clean. To remove an old dressing and clean a wound, you will need a clean surface for your supplies, clean water, disposable gloves, mild liquid soap, and clean washcloths or gauze pads. Start all care by washing your hands with soap and water for 20 seconds and dry them. If you are caring for another person, put on disposable gloves after hand washing. This is for your own protection, even if you are caring for a family member. To remove the dressing, gently lift and peel the tape edges toward the incision. Use your other hand to hold and support the skin while you pull the tape. If the dressing sticks to the wound, wet the dressing with clean water and let it sit for a minute. Lift the tape and dressing off together. Check the dressing for drainage and odor. Place the dressing and tape in a sealed plastic bag before putting it in the trash. Remove your gloves. You may need to change them sooner if they are dirty and you need to touch something clean, or if there is a tear or hole in your glove. Before cleaning the wound, wash your hands and put on fresh, clean gloves. Look carefully at the wound. Call your doctor or nurse if the incision is opening or coming apart, if it is red, warm, or swollen, and call if it is draining and has a bad odor. Wet a gauze pad or washcloth with clean water and mild liquid soap. Avoid using bar soap to clean your wound because it can carry germs. If possible, avoid antibacterial and deodorant soaps as they may cause irritation. Alcohol, peroxide, and betadine can hurt new tissue and slow healing. With one stroke, clean the wound from top to bottom. Use a clean part of the washcloth or gauze for each stroke. Continue washing, slowly working away from the wound until the skin is clean at least 3 inches from the incision on all sides. If you have a large wound, you may need extra washcloths and gauze. Always remember to stroke from top to bottom. Use a new washcloth or gauze for a separate wound. To rinse the wound, wet a new gauze or clean cloth with plain water. Start at the incision and work away to remove any trace of soap, working top to bottom. Use a fresh gauze or cloth to dry the area without rubbing. Place all dirty gauze in a sealed plastic bag before throwing away. Take off and throw away your gloves. If they are bloody or visibly dirty, place them in a sealed plastic bag before throwing them away. Wash your hands with soap and water for 20 seconds and dry them. If you need to put on a new dressing, open a gauze package with clean hands. Do not touch the gauze. Place the open pack on your clean surface. Put on clean gloves. Pick up the dressing by the corners. Do not touch the center. Hold the gauze pad over the incision to position it, then lay it on the wound. Tape the edges of the dressing. Do not cover the center of the dressing with tape unless you have been told to do so. Take off and throw away your gloves. Finish care by washing your hands with soap and water for 20 seconds and dry them. If your skin is sensitive to tape, try paper tape. Latex-free wraps or binders can also be used to hold dressings in place. Ask your care provider for other options if this is a problem. If you are allowed to clean your incision when you shower, gently wash using the liquid soap. Rinse well with clean water. Then pat dry with a clean, dry towel. Call your doctor if you can't get the dressing off, if you have bleeding that doesn't stop, if you have a fever and chills and any other sign of infection such as pain or redness, worsening drainage, and a bad odor. Know that gloves can spread infection if you don't wash your hands first, if you touch clean items with dirty gloves, if you don't change to clean gloves before the next care step, and if you don't wash your hands every time you take gloves off. This video is intended as a tool to help you better understand the care instructions that you have been given. It is not intended to replace any specific advice or personal care instructions that you have received from your care team. If you have any questions or problems, please be sure to call or be seen.